honestly, stomachs can really, in the book it mentions 10 by 12 or 14 by 17. Stomachs, if you do them correctly, you can't do them on a 10 by 12. So we're going to do them on a 10 by 12 in lab. You might see them 14 by 17 in the clinical. So we'll do 10 by 12 crosswise. So we're going to do the AP, supine or prone, depending on institutional routine, 10 by 12. Place it crosswise and center midway between the mid-sagittal plane, left lateral margin of the abdomen at the level of L1, L2, a point midway between the xiphoid process and the lower rib margins. Central ray perpendicular, mark the correct side of the IR. Expiration on these. So on this, so I'm going to center midway, mid-sag, lateral border, right between those two bangs, and I'm going to center at L1, L2. So if you feel like the bottom of your ribs and go up about an inch or 2, inch and a half, 2 inches, you should be about right there. Another thing to do on this, it says like, so basically you're going from xiphoid process to lower rib margin and right there between. If you feel on your ribs where your ribs curve right there, that's usually where you center right there on where the rib curves.
You can feel it, but it's right there. There's a fatty tumor right there.
You have a what?
A fatty tumor right here.
Oh, gotcha. I'm not gonna hurt you or
No, it doesn't hurt, but if you press too hard,
Okay, I gotcha. So right there, that's where her rib curves right there. I'm pretty basically centered right on that. I'll move it just a hair. So, mid-sag, lateral border, right there in the middle, between xiphoid. If you want to feel the bottom of her ribs, you can go about 1 or 2 inches up. Another good thing to do is like right there where that curves, right there. There's where her rib starts curving around. Take a breath in. Pull it all the way out. Hold it out. Expose. So it should be right there over the stomach. So you can kind of go about a lot of different ways. If you want to feel the bottom of the ribs, go about 1 inch to 2 inches. Boom, boom.
And where does it start and stop again? You said that
My light is right here. I'm centered there. Right, kind of where your rib curves. We're going to do the LPO while she's still on her back. So from patient supine position, rolled up on the left side from 30 to 60 degrees. So I'll do a solid 45 for cynic patients, average patients. Centering's the same, midway between the patient's lateral border and vertebral column. To the left side, perpendicular to the left of the body of the stomach, midway between the xiphoid process and lower rib margin, same thing. So centering is the exact same, positions different. So go ahead and bend this right leg up for me, put your right arm across your chest, and I'm going to roll you up towards that wall. So just solid 45 degrees right there. I'm going to center right over her stomach. Go ahead and move your arm out just a little bit. So for this one, same thing. So xiphoid process, there's the bottom of her ribs. I'm still gonna go 2 inches up. She really hadn't moved much. I'm still kind of right there where her ribs are right there. I might culminate just a little because I still want to see over here. I might culminate just a little bit from side to side on her. She's small. I have some room on the table. And then if you do want to put your left marker right there, that's fine. So because when you turn over, you're going to be a lot smaller right there, especially on her. She's small. You're all going to have some light, but I don't want to crop it too far on this side. Mm-hmm. So this is kind of one of the only times I'm like okay with having light on the table. If you want to put your left marker right there. Some other people, it might not have any combination. Y'all are pretty small. There's going to be some light on the table. You can relax. Same thing, still that same centering. Bottom of the ribs, 2 inches up, midway, xiphoid. bottom border of the ribs. Let's go ahead and do the lateral before she turns over to the, on her stomach. So we're really gonna do a right lateral on this one. We'll do a right lateral, kind of the same thing. You really can do each, but we'll do a right lateral so she's facing me when she's doing this. But really either or, so I'll do right on this one. So go ahead and turn on me on your right side. Your arms up. Good. Bring your hips towards that blue. Good. So in this one, right lateral position, it says center midway between the mid-coronal plane and the anterior surface of the abdomen. Still going to be that 10 by 12 crosswise. It still says center to the level of L1, L2. Place a right marker in front of the patient. So this one is kind of the one, this does depend on patient size on this one. So basically what you're going to do, find the anterior portion of the stomach, mid-coronal plane, and center right there in between. If I was this far out, I would take that, and center right there. So on her anterior portion of the stomach, mid-coronal plane, I'm going to center between those two things. This is kind of one of the only positions that's really kind of dependent on patient size, because I'm going to go to the front of her abdomen, no matter how big or small it is. So mid-coronal plane.
So someone had like a large gut, you get to push it until you feel the ribs.
You can, yeah.
Is that okay?
There's the bottom of her ribs, so I'm going to go about 1 to 2 inches. I'll do about 2 inches. So anterior portion of the stomach, mid-coronal plane, right there in the middle, down the bottom of her ribs. I went up about 2 inches, and then I would put a right marker here in front, right there. So I'm still doing all these 10 by 12 crosswise, following the part right there. The stomach's going to go out. I put a right marker in the front. Really do right or left on that. Kind of just have right on the paper just to kind of keep doing like how we did on the esophograms. Esophograms usually do right, just so you're facing me. But you probably won't have to drink anymore when you're doing these, usually not. So, but either or. And then go ahead and lay on your stomach. So the last one is going to be the RAO. Prone position, roll them up on their right side, mid-sagittal plane, towards 40, 70 degrees. Hyperstented patients, more degree rotation, still at 10 by 12. Center midway between the vertebral column, lateral border of the elevated side, 1 to 2 inches above the lower rib margin. So this position is almost kind of like how some people sleep. Scoot your body just a little bit towards that wall. Kind of bend your left knee out like this. That should give you a pretty solid position right there, because it's 40 to 70, hyperstenic a little bit more on that. So usually this is pretty good position right there, just kind of like how you sleep. So same thing, lateral border, vertebral column, we go right there in the middle of those two things. Bottom of her ribs, we go about 2 inches up, right there. Lateral border, vertebral column, middle, 2 inches up, and I put the left marker right there.
So you can put the marker on the person. Is that what
No.
you're saying?
No,
No.
I meant like just on the image.
Oh, okay, gotcha.
So, yeah, I wouldn't. You might see that done in clinical, I just wouldn't. But,
Yeah, I had a tech that he was
People
doing
do
that.
that?
Yeah.
Oh, yeah,
It's
yeah.
bizarre. It seems like there's too much. to-
We were doing the spine. Yeah, that was on the L spine, and he just like put it right. Like told me to put it right here.
Yeah. I mean, you might see it done a lot. I definitely would know it's in the light if I did that. My problem is it might get lost on the patient, you might forget about it, they leave with it, and that really does make it pretty magnified. So that's my two problems with it. But you do see it done a lot. I do get the reasons why. Those are the reasons why I don't do it. You can relax if you need to. So really not, it's all really the same, just your position's different. So all of them, vertebral column, lateral border, in between those two things. Find the bottom of the ribs, go 1 inch, 2 inches up. Most of them, we should be right on that curve of the ribs.
Is there an axial projection?
That's gonna be on the BE.
Okay,
So those four are the ones for the stomach.
I see.
So you got AP, LPO, RAO, lateral.
So we did the LPO,
Yeah,
but you can do the same on the RA. It's the exact thing? I
RAO.
mean, RA.
I did, yeah.
Gotcha.
Yeah. Questions on any of those? They're pretty repetitive. I mean, they're pretty, you know how to do one, it's just getting enter the position.
Now, when you laid me on my stomach, that was the RA?
Yeah, if you were like
Or
that.
is there what's the angle on that? There wasn't, okay.
Oh, well, your angle,
No, well, you were saying something about,
the angle's like 40 to 70, but I usually just put people like that, and they usually fall pretty close to 45.
okay.
Yeah. So, BE, usually you will do projections for BEs, no matter, they usually do the pictures afterwards. I would say 80% of the time, probably more than that. But a lot of times BE, you do those pictures afterwards. I'm not gonna go over the AP and lab, and AP and lab is just like an abdomen, like we've done a gazillion times. So I'm not gonna go over that one. AP axial projection, it says with a patient on the x-ray table in supine position, sitting in the mid-sagittal plane. You can use 14 by 17 or 10 by 12. Most of these are going to be 14 by 17, so I'm going to stick with the 14 by 17 for most of the BEs. Centered 30 to 40 degrees cephalic, inner 2 inches below the level of the ASIS. Top of the image receptor 2 inches above the crest. So the same. Suspend on suspended expiration.
On the RAO, are you doing a bigger angle if the patient's bigger?
Yeah. So 30 to 40. I'll go ahead and just do a solid 30. Get one spine. So I'm gonna find her ASIS. ASIS, 2 inches down. Center right there in the middle.
Kind of like the SI.
Yeah. Pretty
The
similar.
one-
Yeah.
Just go down.
Pretty
instead of-
similar. Yeah.
That I did.
That's why I'm like, if you do one of these, I mean,
Yeah.
they start kind of, you know. So I did it 14 by 17, ASIS, 2 inches down, lined it up, like you said, pretty similar to that. So suspend on, or stop breathing on after expiration. Then you got RPO and LPO, patient supine position, roll them up 35 to 45 degrees. So basically all these, you can do a solid 45, I mean, you're good. 14 by 17, center 1 inch to 2 inches lateral to the midline of the upside, perpendicular central ray at the level of the iliac crest, mark right or left side, suspend, hold your breath after, suspend after expiration. So go ahead and put your right arm across your chest, get your right leg up, and I'm gonna roll you towards that wall. So kind of don't, go back flat, because you're kind of like you're kind of rolling a little bit more, so go ahead and bend your knee up, and then I'm gonna roll you towards that wall, so you're nice and straight. So I'm gonna do it at the level of the crest. And it says 1 to 2 inches lateral from midline. So there's midline right there. I'm gonna go 1 to 2 inches over. Do 2. crest, midline, 1 to 2 inches over. Have her about a solid 45 degrees. Right then, out, expose. LPO is going to be the same thing. I won't go into it, give y'all more time to practice, but I mean, same thing. Rotate her towards me, 1 to 2 inches, lateral to the mid-sessional plane. You can relax. So, we are going to do, I'll do this here in a second. Take a second to get set up. We're going to do some cubes on this one. So that'll be kind of the one really need to practice because we haven't really set it up when y'all talked about that. But you usually do the cubes on BEs. So I'll do that in a second. Lateral projection, right and left lateral. Basically just getting a different position of the colon. Position the patient lateral recumbent position, right or left side. 10 by 12 on this one. So this is really the only one we're doing 10 by 12 on the BE. Center to the mid-coronal plane at the level of the ASIS. So you want to go ahead and turn up on your left side for me. Shoulders on shoulder, hips to hip. I am going to do this one at 10 by 12. What was the last one you just did? LPO. We're doing all the BE now, so I'll be looking at your colon. Yeah. So this is going to be on mid-coronal plane at the level of the ASIS. So mid-coronal plane, ASIS, 10 by 12. So I put my left marker there in the front. So that's going to be my lateral colon right there. Really just kind of getting the rectoid sigmoid area. We'll talk about tomorrow. That's why it's just a 10 by 12.
How common is it to do BEs with X-ray? Do they do it more with CT now?
It really kind of depends on your site if you're going to see them or not. I know some sites, I would have to ask Janice which one, but people have seen a handful of them. So I feel like you'll probably see them at some point. So you can relax. I'm going to go get the grid on with that. So I'll read through this one real quick. So, a lot of times, I mean, you can do this AP or PA, facing the board, not facing the board, but most of the time, all the time, you really are going to do it with the right and the left because there's certain things you see, and we'll talk about that tomorrow. So usually if you're doing the decube, you'll do both. Right or left side with either a dorsal or ventral surface against the grid. So we're just going to do it, we're going to do an AP, 14 by 17, horizontal central ray, center to the midline of the grid, IR center to the level of the crest. Mark the side of the patient that is upmost with the correct marker placed on the IR. Suspend on expiration. Upside is the side of interest. So if you want to go ahead and roll towards blade there. Okay. So kind of like I did before, I have the little tick mark on here. What I'm going to kind of just do is find her crest, and pretty much align that tick mark to the top of her crest. So I'm going to kind of push this underneath your hips real quick. Bring this shoulder back towards me. This one. Yeah, you're good. Can you back up to the cassette for me? Just, yep, good. Try to get her back as flat. That's why it's just so much easier to put the back. Your back's going to be a lot flatter than your stomach. Just a lot easier to put your back flat. So I'm going to find the top of her crest right there. And I'm going to try to match. It's super easy. I can just slide this wherever I need it to go. So there's the top of her crest right there. I'm going to try to match that tick mark. I'm going to kind of look at it from the other angle too. Match that tick mark to her crest right there. Try to make sure, move your bottom forward just a hair. You want to make sure this is nice and straight. Everything we talked about today, just make sure it's straight. It's not all level. line that up to the tick mark right there. So, top of her crest is right there. I'm gonna move this back just a little bit. Top of her crest is right there. Then I'm gonna line that here in a second. So, I'm basically centered to her, and open that up to the image receptor right there. So I'm gonna move that just a little bit. I'm gonna turn that
You can wait.
No, I'm just turn that up on for me. Okay. Here, and then left side's up. Left backer up there. So honestly, on this, the side of up is the side of interest, so that's why I'm really like not too worried about like putting something underneath her and popping her up. If I was doing like a straight up abdomen, I would be. Honestly, to me, I'm not as worried about that because side up is the side of interest. So I will do the other one here in a second to see that downside. So I'm basically going to get this centered to the top of her crest, match that up right there, open it up, 14 by 17. I did have to back this up a minute because it was a little close. I'm still at 42. I'm still okay because I got stuck at my table right there. I had to back it up, but I'm at 42, so that's okay.
Could it be that you measuring at an angle too?
Oh no, I was at 40, but this would hit the table when I was bringing it down, so I had to back it up. So yeah, but yeah, that's probably the most difficult one I'll do because I've done that in a minute. But all the other ones are pretty